What we will cover today, I'm going to tell you a little bit what we learn in pharmacy. I will tell you a little bit more about your first year in the course of your MPharm degree. And then we're going to be looking at what we need to do to manufacture good medicines. And I'll be talking about this by explaining to you how we make decaffeinated tea, something very simple for you to understand the processes of manufacturing a medicine. And at the end, you'll be taking a part in a project and to look into more about manufacturing medicines and what happens when something goes wrong and the implications of making bad quality products, medicinal products. In your first year of study, in year one, you have 10 cases, and they're designed for you to gain an understanding of all the basic principles in pharmacy and using like different medicines. So it's such a good introduction to the whole course. And so you get to be taught about stuff like skin conditions, eye conditions, basic things that you always see over the counter, which is amazing. And your learning is supported by a placement in a community pharmacy. So I did one placement for a day. I think it was for 4 hours in a community pharmacy to see what it's like, which was really hands on. The course is taught by a case-based system. So as I said, there's 10 cases in the year, and you get to see the science behind the patient care. So for example, the first case that I studied was about conjunctivitis, and so they taught you what that was. So that's what it was, how they treat it, what questions you need to ask the patient to be able to give the correct over-the-counter medication. And so it really integrates chemistry, pharmaceutics, microbiology, physiology, everything together in one case, which is really amazing. Sometimes they do one or two or three of those stuff in one case. And then as the cases progress, you're going to be able to delve into all those topics. And then in second year, you have 12 cases. In third year, you have 14. So the amount of work will become more every year. So the assessments are both exams and coursework. So coursework will be the assignment. The exam is weighted at 70%, while the coursework is weighted at 30%. There are 4 modules that run across the year that integrate those cases specifically. So, for example, in year one, because there's 10 cases, in the first module, you'll have 2 cases. In the second module, you have 4. In the third module, you have 4. And then the fourth module is to do with, as I said on the screen, on the slide, you have to do a CPD, which is a continual professional development. So when you go on your placement or when you learn something, you write about it so you can continue becoming a better pharmacist in the future. And an OSCE, which is an objective structured clinical examination. In this, you'll have stations and you'll talk to patients, and then you'll ask them a couple questions that we'll go through today, and to see what best treatment or advice could you give a patient. You also have to do a maths exam, which is really important because maths is a really important part of pharmacy. So it's pharmaceutical maths, and it's just really important that you have to get 70% to pass this. All the other exams, you have to score a threshold of 40% in both exam and coursework. But the math is really important because, as I said before, that is a part of your pre-reg training, that you must also pass that exam at 70. So in your degree, it is continually helping you to be able to score the best grade, the best you can, when you become a trainee pharmacist. What do we need to manufacture medicines? To understand what is important in making a good medicine and how to manufacture a good medicine, I'm going to be talking about making a cup of decaffeinated tea. And hopefully you'll be able to understand and relay back and always remember the really key aspects of making a good medicine by just relating it to an everyday thing that we do, is making tea. So the first thing we think about when we're making our decaffeinated tea is the active ingredient. So to make tea, you need a tea bag, right? So here, are we going to be using maybe one like tea that's left on the side? You don't know how old it is. Or are we going to be using English breakfast tea that's decaffeinated in its packaging, that you know where it's from, you know the expiry date. So it's the same thing when we think about manufacturing of medicines. When we're using, for example, we're making Calpol, you know the active ingredient is paracetamol. So where are you going to get that paracetamol from? Okay, so that's the first thing we need to think about, is the active ingredient. So which type of active ingredient are we going to be using? So what I'm trying to convey is that we're going to be using an active ingredient that we know where it's from, we know how long it's been around for example. The second thing we have to think about when we're making our decaffeinated tea is what else do we need to make it? So obviously you need to get water. So it's called something called a diluent. A diluent is something that you have to add to a product, even in your medicine, to bulk it up. So in tea, you're going to be using water. So what kind of water will you use to make your tea? Are you going to be using water that is safe to drink? Or are you going to be using water from the tap? Are you going to be using the water that's dirty? So which kind of water we'll use? So when we're thinking about making our medicine, we're thinking about actually what's the quality of the ingredients that we're using? What's the quality of the diluent? So when we're making a tablet, for example, the diluent we use is lactose. So you have to think about, where is it from? Is it clean? The quality. That's really important. So when we're making our tea, we're adding the water now. Now we're on our third part of making our decaffeinated tea. And in terms of manufacturing of the medicine, now we're adding another raw ingredient, so a diluent, so like a bulking agent, or an excipient. An excipient is an inactive substance that serves as a vehicle for a drug or other active substances. So an excipient doesn't have any pharmacological effect like the active ingredient does. An excipient in manufacturing medicines would be like a coloring agent, a preservative, a filler. So it could be a cellulose or cellulose derivatives when making a drug. But now as we're talking about decaffeinated tea and making that, which kind of milk are we going to be using? Are we going to be using the milk that's, as you can see, spoiled, or the good milk? So we're thinking about the quality of the products that we're using. So when you think about spoiled milk, it could be because it's too old, like the milk has been out the fridge for too long, or that it's been in the fridge, but it's been in the fridge for too long. So it could be outside the fridge or inside. So you have to make sure that where you're putting your products, your ingredients, are being stored in the right place. So this leads us to storage. So where are we storing the medicines and the ingredients to make the medicines? So we know that a milk needs to be in the fridge for it to be good, because when we're making our medicines, we don't want to make something that is pharmacologically toxic, so it can make people ill. So we need to make sure it's perfect conditions, perfect qualities to be able to make our drugs, our medicines. So when we are making our decaffeinated tea, we need to make sure we're making it in the right place. So we'd rather a kitchen that's clean, it's easy to wipe down the surfaces. So that's what I mean, like it's easy to clean instead of the picture at the bottom. So when we're making and manufacturing medicines, we need to make sure that the place that we're doing it is easy to clean and easy to make in the correct environment. Personnel. So who's more professional, the guy at the top or the guy at the bottom? So when we're thinking about it, not anyone can go and make medicine. Someone has to be qualified. They have to have their certificates. So as you can see, the guy at the bottom with the hat on, it suggests that maybe he's more professional and trained than the person at the top, because when you're making the medicine, you're manufacturing them, you need to be wearing the right clothes. You don't want to contaminate anything with hair or skin. You don't know what's underneath your nails. So you have to be perfect. You have to be the perfect equipment and the perfect clothing and everything to make sure that we're making the best quality products. And so that's the same thing with making your tea, your decaffeinated tea. It has to make sure that the person who's making it can and is able to make the tea that you need. As you can see here, what equipment are we going to be using? Are we going to be using a kettle that's old or a kettle that's new? Even as you can see on the pink kettle, there is a dial and you can see how hot the water is in comparison to the other one. So the pink one has more information. As you can see, it looks like it's more easy to be able to be clean. So you have to really think about all this kind of stuff when we are manufacturing medicines. Is that, are we using the right equipment, and is the equipment perfect? Is it fit for use? Packaging. So as you can see, one mug is clean and one mug's not clean. So when you're making your tea and you're making your decaffeinated tea, are you going to be using a mug? Are you going to drink out of it of a clean mug or a dirty mug? So the packaging you're using must be fit for purpose. And finally, transport. So how are you going to make sure that the decaffeinated tea you have will be able to go to the right place that you want to sit on your desk and drink it? The same thing when we're manufacturing medicines. Is the medicine going to be transported without it being spilt? If it's a suspension or like a liquid, or it doesn't break, so that if it's a tablet, you make sure it doesn't break. Without it, as you can see, spilling, we can think about it degrading, the medicine degrading. You can think about, actually, you need to make sure that your tea, when it reaches you, is still warm. So you need to think about it, and it's not cold. So this is something you need to think about even when you're manufacturing your medicines and then you're transporting it, that the final product of the drug is perfect and safe. Now we're at the end product. Are you happy or sad about the end? So is the medicine you've made, good or bad? The second thing we have to think about is every single cup of decaffeinated tea the same? So when we're thinking about the active ingredient, do we have exactly the same amount of active ingredient every single time? And when you're making your tea again, your decaffeinated tea, are we using exactly the same amount of tea, exactly the same amount of diluent, so water, exactly the same temperature used, the same premises, the same personnel? These are things you really need to take in consideration, because as I said, all the same type of product, the same type of drug that you're producing, you're manufacturing, needs to be exactly the same. You can have discrepancies between tablets, because this can cause so many problems. So we do need to test if the drug is the right one. Further studies. So there will be a project on a wide area about manufacturing medicines, and as we've described the process of making the perfect decaffeinated tea, we're going to be thinking about what will happen when something goes wrong in manufacturing of medicines. You'll be looking at counterfeit medications and all the kind of things that can go wrong, and that do go wrong, and what are the consequences of that. I hope you've enjoyed this and this made sense. If you have any questions, you feel free to ask me. And yeah, so hope you learned something new.